There is something in your kitchen right now that millions of people over 60 use every single day because they were told it was the heart-healthy choice. It is in the spice aisle at every grocery store. It has words like low sodium and heart healthy on the label. Doctors recommend it. Dietitians recommend it. It is practically standard advice. And for most people, it genuinely is a smart swap. But if you take a specific type of blood pressure medication, this healthy choice could be quietly pushing a mineral in your blood to levels that affect your heart. It often has no warning signs in the early stages, and when symptoms do appear, they can look so much like normal aging fatigue, muscle weakness, a heart that feels slightly off that most people never connect them to what they sprinkled on their breakfast. This is one of the most underwarned interactions in senior health, and it is hiding behind a label that says it is good for you. If you are over 60 and you take any medication for blood pressure, this video is specifically for you. Especially if your medication's name ends in pril or sartan. By the end of this video, you will know exactly what to check on your kitchen shelf, why this interaction happens inside your body, and what to use instead that adds real flavor and is completely safe for you. As always, this is for educational purposes only. Please speak with your doctor or pharmacist before making any changes. High blood pressure is one of the most common health challenges after 60. According to the American Heart Association, nearly half of all adults in the United States have it, and the numbers climb even higher as we age. So when someone with high blood pressure is told to cut back on sodium, they listen. They go to the store, they find a low sodium salt substitute. They make the switch and feel good about it. And here is something important I want you to hear. For many people, that switch is genuinely the right choice. A large study published in the New England Journal of Medicine involving nearly 21,000 people, average age 65, most with high blood pressure, found that salt substitutes helped lower blood pressure and reduced stroke and cardiovascular risk. That is real. That is good science. But there is a specific group of people for whom one type of salt substitute creates a serious and documented danger. And that group includes anyone taking a class of blood pressure medication called ACE inhibitors or ARBs. These are among the most widely prescribed medications for seniors with hypertension. Lisinopril alone, one of the most common ACE inhibitors, is one of the most prescribed drugs in the United States. Period here is what most people do not realize about the label they are trusting. Regular table salt is sodium chloride. Most low-sodium salt substitutes replace some or all of that sodium with potassium chloride. Potassium chloride looks like salt. It pours like salt. For many people, it tastes close enough to salt to make the switch feel seamless. And potassium is genuinely something your body needs. It supports heart and muscle function. It actually helps lower blood pressure in people with high sodium sensitivity. So on the surface, this swap sounds like it should work perfectly. But here is where it goes wrong for a specific group of people. ACE inhibitors and ARBs, the medications whose names end in pril or sartan, work partly by helping your kidneys retain potassium. That is part of how they reduce blood pressure. Think of it this way. Your medication is already holding the door open for potassium to stay in your body. Now you sprinkle a potassium-based salt substitute on your eggs at breakfast. Suddenly, your body is taking in far more potassium than your kidneys can safely manage. And there is a second factor that makes this especially risky after 60. As we age, our kidneys naturally become less efficient at filtering the blood. That means Potassium clears from the body more slowly than it did at 40 or 45. So you have aging kidneys already working harder, a medication actively retaining potassium, and a salt substitute delivering a concentrated load of it at every meal. The result is a condition called hyperkalemia, hyperkalemia, too much potassium in the blood. There is a peer-reviewed case report published in the medical literature that documents exactly this situation. Two patients, both on ACE inhibitors for high blood pressure, both using a potassium-based salt substitute called low salt. Both developed severe hyperkalemia. In each case, the attending doctor nearly withdrew the blood pressure medication, thinking the drug itself was the problem. It was only when they stopped the salt substitute that potassium levels returned to normal. The salt substitute, the product the patient was using specifically to be healthier, was the cause. When potassium reaches dangerous levels, it disrupts the electrical signals your heart depends on to beat correctly. According to the American Heart Association and the Mayo Clinic, serious hyperkalemia can cause muscle weakness, numbness or tingling in the arms and legs, heart palpitations, irregular heart rhythms, and in severe cases, cardiac arrest. And here is the part that makes this interaction so difficult to catch. In its early stages, hyperkalemia often has absolutely no symptoms. Potassium is climbing in the blood. The person feels completely normal. When symptoms do appear, they look so much like the normal aches and tiredness of getting older that most people never connect them to their salt shaker. Here is what I want you to do right now. Not at the end of this video. Right now. Go to your kitchen and pick up your salt substitute or low sodium seasoning. Turn it over to the ingredients list. You are looking for two words: potassium chloride. If you see those two words, come back, because in the next 2 minutes, I am going to tell you exactly what that means for you, which specific medications make this dangerous, and what to replace it with that is safe, flavorful, and doctor approved. Potassium chloride is the ingredient that creates the interaction. On labels, it sometimes also appears as KCl, the chemical symbol. Products like Morton salt substitute, no salt, and new salt are made almost entirely of potassium chloride. 1 teaspoon of these products can contain well over 2,000 milligrams of potassium. That is nearly half of the total daily potassium intake recommended for an adult. In 1 teaspoon, used at a single meal, light salt products, which blend sodium chloride and potassium chloride, roughly half and half, carry a lower but still meaningful potassium load for someone on these medications. If potassium chloride is anywhere in your salt substitutes ingredients and you take blood pressure medication, that is the conversation you need to have with your doctor or pharmacist. The rule for checking your medication is simple. Look at the name of your blood pressure medication. If the name ends in pril, you are on an ACE inhibitor. If the name ends in sartan, you are on an ARB. Both of these medication families work by retaining potassium in the body. That means potassium-based salt substitutes need a conversation with your doctor before you continue using them. This also applies if you have kidney disease, diabetes, or if you take a water pill that preserves potassium like spironolactone. Any of those factors raises the risk further. Now here is the part where your food gets its flavor back. There is an entire world of seasoning that adds depth, richness, and brightness to food without a single milligram of potassium chloride. Herb and spice blends with no potassium chloride. Products like Mrs. Dash Original are salt-free and potassium-free. They use herbs, onion, garlic, pepper, and citrus peel to build flavor. If the ingredients list has no potassium chloride, it is safe for this interaction. Fresh or dried herbs used directly on food. Rosemary on roasted vegetables. Basil on eggs. Thyme on chicken. These require nothing from your medicine cabinet conversation. Fresh citrus. A squeeze of lemon or lime over fish, eggs, or grain bowls gives food that bright acidic lift that makes it taste alive without salt and without potassium chloride. Garlic and onion powder with no added salt. Balsamic vinegar, red wine vinegar, apple cider vinegar, small amounts on salads and vegetables replace the sensation of salt more effectively than most people expect. Your food does not have to be bland. It just needs the right ingredients, ones that work for your body, not against it. Here is the single sentence that matters most from this video. If your blood pressure medication ends in pril or sartan, potassium-based salt substitutes can cause potassium to build to dangerous levels in your blood, and the early stages are often completely silent. The fix is 3 steps. Check your salt substitute label for the words potassium chloride. Check your medication name for pril or sartan. If both are true, speak to your doctor or pharmacist before your next meal. I want to say one more thing before you go. You are not doing anything wrong. You picked up that salt substitute because someone you trust told you it was better for you. That advice was given in good faith. It just did not come with the one extra piece of information that makes it the right choice for your specific body, on your specific medication. That extra piece of information is exactly what this channel is for. Not fear, not alarm, just the specific truth that makes your good choices even safer. If this helped you today, subscribe. Every week I bring you one thing your doctor didn't have time to explain, and it is always something you can actually do something about. Before you close this, we have covered grapefruit and cholesterol medication. We have covered salt substitutes and blood pressure medication. Next week, I am going to cover something that affects thyroid medication. Tens of millions of people take it every morning. And there is a food, one single food, that can quietly reduce how much of that medication your body actually absorbs. Not by a small amount, by up to 40%. And it is not grapefruit. It is not a supplement. It is not anything unusual. It is something most people eat within 30 minutes of taking their pill every morning without knowing. That is next week. Don't miss it.